Today's topic is burning eyes. Everything you need to know. Burning eyes cause a stinging and gritty sensation with the white part of your eyes appearing pink or red. Other symptoms that may accompany the burning are puffiness, itching, and discharge. Causes of burning eye. Understanding the underlying cause of the burning eye can help prevent future problems. Let's take a look at some eye conditions that can cause burning or stinging. Number 1. Blepharitis. Blepharitis causes the inflammation of the eyelids. It is triggered by a clogged oil gland at the base of your eyelids. It is accompanied by symptoms like watery eyes, flaky around the eyes, itchy eyelids, sensitivity to light, and sometimes you may lose your eyelashes. Although blepharitis isn't contagious, it can become a chronic condition. Number 2. Dry eyes. Dry eyes are caused by poor lubrication. It not only causes burning, but also sensitivity to light, eye fatigue, eye redness, and mucus around the eyes. Depending on the severity, it can be uncomfortable to wear contact lenses. Other factors trigger dry eyes. They include allergies, wind and smoke exposure, and working at a computer. You may also develop dry eyes if you have arthritis, or if you take an antihistamine or an antidepressant. Number 3. Allergies. Eye allergies that trigger burning eyes are smoke, dust, pollen, and dander. Apart from eye discomfort, you may also experience other allergy symptoms like watery eyes, sneezing, coughing, a runny nose, and a sore throat. Number 4. Photokeratitis. Overexposure to the sun's ultraviolet rays can lead to sunburn on your eyes. This leads to eye burning, headaches, redness, blurry vision, sensitivity to light, and temporary vision loss. Number 5. Conjunctivitis. Conjunctivitis is the inflammation of the conjunctiva, which is a thin layer of clear tissue covering the white part of the eye. It is a viral or bacterial infection and can be contagious. You can also get pink eye from allergic reactions. Number 6. Eye strain. Eye strain occurs if your eyes burn after staring at a bright computer screen. Eye strain can also develop after exposure to dry air or driving long distances. Diagnosis. Burning eyes usually improve with home remedies, but if symptoms worsen, you should see an ophthalmologist or an optometrist. You should also see a doctor if you experience blurry vision, double vision, eye floaters, or eye discharge. Your doctor will ask about your medical history and other symptoms you have. You will also undergo a comprehensive eye examination. Bright light and magnification tools will be used to examine the inner structure of your eye and your eye tissue. Treatment. The treatment plan varies with the cause of your symptoms. Prescription antibiotics in form of eye drops will be used to treat bacterial eye infections. Viral eye infection usually goes away within 2 to 3 weeks. If you suspect a foreign object in your eyes, do not try to remove it yourself. Seek medical help. Steroid eye drops can relieve inflammation and itching. They also help in treating ulcers formed in the eyes due to damage from an infection.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.